What are the survival rates for seminoma? Imagine hearing you have testicular cancer and wondering what your future might look like. Well, the good news is that seminoma, a common type of testicular cancer, generally has very high survival rates. Overall, about 95% or more of men diagnosed with seminoma live at least 5 years after their diagnosis. That means if you or someone you know is facing this, there is a strong chance of successful treatment and recovery. Survival rates depend a lot on how advanced the cancer is when it's found. If the cancer is limited to the testicle or has only spread to nearby lymph nodes or the lungs, the outlook is excellent. In these cases, about 95% of men survive for 5 years or more. This is called a good prognosis. When the cancer has spread further to other organs like the liver or brain, the survival rate still remains high but drops slightly to around 90%. This is considered an intermediate prognosis. It's important to know that pure seminoma is not classified as having a poor prognosis. It responds very well to treatment, which often includes surgery, radiation, or chemotherapy. When the cancer is caught early, the chances of successful treatment are even better. For example, if the cancer is confined to the testicle, the 5-year survival rate is nearly 99%. If it has spread to nearby lymph nodes, the rate is around 96%. Even when it has spread to distant organs, the survival rate remains relatively high at about 72%. These figures show how effective current treatments are and how important early detection is. The stage at diagnosis, tumor size, blood markers, and overall health all influence outcomes. Men who are diagnosed early tend to have better chances of beating the disease. Advances in medical treatments and participation in clinical trials continue to improve these survival rates. In summary, seminoma is a reproductive cancer that affects the testicles but has very favorable survival prospects, especially when caught early or with limited spread. If you or someone you care about is diagnosed, seeking prompt, specialized medical care can make a big difference. Remember, every case is unique, so personalized medical advice from healthcare professionals is essential for the best possible outcome.